Though breastfeeding is recommended by the World Health Organization, some mothers struggle breastfeeding due to pain, inadequate milk production, or even lack of weight gain in their infants. Some of these challenges may be caused by restricted tongue or lip movements that limit adequate function to draw milk from the breast. Even infants that are fed by bottle can struggle with these same symptoms when lip or tongue ties are involved. Mothers' symptoms, such as pain with latching, mastitis, and plugged ducts, as well as infant symptoms, such as inability to maintain latch, gumming the nipple, and gassiness or reflux, are all symptoms that warrant further evaluation. Though nursing may be one of the struggles that prompt a solution, untreated, some restricted tongue and lip ties can cause problems later in life. Because they are often underdiagnosed, tongue and lip ties can lead to real struggles for mothers and infants. Some of our breastfeeding mothers were willing to share their story.
Pretty much every time I nursed, it was excruciating pain. I just had to grit my teeth and squint my eyes closed and just battle through the nursing session.
I have two older ones that both nursed, but what I really did notice was lack of that latch that I felt with the first two. She was nursing both sides just fine, but after we would nurse, it was about 15 minutes like clockwork, she would spit everything up. So I was always walking around with a rag, and I just thought, I'm a chiropractor myself, I thought, it was my diet, something I was eating, so I kept trying to find things like that. And I would just go on and on. She was also needing to nurse every hour and a half to 2 hours because she was spitting everything up. So it was kind of a toll on me as far as she needed me. She wouldn't take a pacifier, she wouldn't take a bottle, and she was needing me every hour and a half to 2 hours around the clock. So it was interrupting nap time, it was interrupting her bedtime. I didn't have the pain that I heard other people experience with lip or tongue tie. I had kind of heard about lip and tongue tie before, but I just kind of excluded it because I didn't have that pain that a lot of mothers say that they have.
She was having a hard time staying latched. She'd get on and come off a lot, and you could tell her lip didn't open up enough to latch on properly, and so it was causing her to get fussy and mad and be frustrated at the breast.
I actually called to make the appointment for him from the hospital bed the day that he was born. Like I said, he's my fourth. I breastfed all of my other ones. The first two were easy, luckily. My third child, she had an undiagnosed lip tie, and we had lots of issues with her. I had mastitis at least half a dozen times. She had some problems with tooth decay and speech delay and that type of thing, and I didn't know that that was what the problem was until she was a lot older. And so when Kane was born, the very first thing I did, I counted fingers and toes, and then I checked for a tongue tie or a lip tie, and I noticed right away that he did have an upper lip tie, and so I wanted to make sure that that was taken care of. As far as symptoms from him directly, he had a lot of problems latching on. He would latch on, and then it was like he couldn't maintain the suction. He would fall right back off. The first 5 days from the time that he was born up until we had the lip tie corrected, we had a lot of issues. He would only be able to nurse for maybe 2 or 3 minutes at a time, and then he would get frustrated and cry, and it wasn't something that I was used to. I was used to nursing being easy, and it wasn't.
The same day that we had Killing's tongue tie fixed, nursing no longer hurt. It was a huge difference, and actually for Killian, it was a relatively painless process. After the procedure was done, he came in and I nursed him for about 10 minutes, and he did not fuss about the procedure after that.
We brought Parker in at about 4 months just because I knew something was up with that hour and a half to 2 hour nursing, and somebody had referred us to Dr. Jensen. As soon as we brought her in with the consult and she had the revision done, Dr. Jensen said I would nurse immediately afterwards, which was a huge relief to me. I thought I was going to have to wait a little bit longer. And I noticed as soon as she latched on, I felt that deep latch that I had felt with the first two. So I knew there was something that was happening right away. She also took the longest nap she's ever taken because she kept that the milk down. So she slept a very long time, got up, nursed again, and we've had great nights sleeps and naps after that. I also went from that 1.5 to 2 hour nursing time period to what I would think would be regular for a 4-month-old, about 4 to 5 hours in between each nursing. She would also take a bottle. I could express and somebody else could give her a bottle. So I got my date nights back. I got to take a kid out, have a little time to myself. So those were some big improvements. She also seemed a little less fussy than she had before.
Right after the procedure, she nursed, and she seemed to stay latched on pretty well. And she didn't really have any recovery. She just nursed better immediately and had a better time staying on. Wasn't frustrated anymore.
Right away after the lip tie was corrected, he was able to latch on and stay latched on and take a full feeding without having to fight and struggle to keep him latched. I didn't have to, worry about he was in the exact right position or anything like that. Once he was on, he was on. I didn't have to worry about him falling off and getting frustrated, and he got full and was a happy baby.
At Broadway Family Dentistry, we evaluate infants both by anatomy and by function of their tongue and lip. If a tie is diagnosed, the revision or frenectomy can be done quickly and easily without the need for sedation. The revisions with the laser have the lowest risk for bleeding, scarring, or complications, and infants heal quickly with minimal discomfort. If you or someone you know is struggling with some of the symptoms described, you are not alone. Please call for an evaluation so we can help you and your infant find a solution.